Good afternoon and welcome to United TV. It's our Bariatric Friday event, 3 p.m. on August 16th, 2024. Dr. Irna is here in our studio with us. Dr. Irna, how are you doing?
I'm doing great, Mo. It's good to be here again for yet another wonderful session of Bariatric Friday.
It's good to have you. So today, in our new circle of the topics, we are going to focus on risk and complications of bariatric surgeries. So the way that we process the flow is every patient who comes through our system, they start with a consult with the surgeon. In many cases, we try to address everything in that visit, but of course that's not going to be possible. So then there are some follow-ups and other specialties who are clearing the patients. Now, there's always a really good reason for those steps that we take, is because at the end of the day, screening is one of the most important process of the safe surgery. And we take this extremely seriously, and that's why we also want to make sure that our patients are well educated for risk and complications of bariatric surgery. So Dr. Irna is going to help us with the elaboration of this, and I'll have some questions as a follow-up.
Of course, absolutely. So bariatric surgery is currently the most effective treatment we have for severe obesity or morbid obesity. It involves essentially, with any of the procedures we undertake, it involves some change to the upper portion of the digestive tract. That would involve the food pipe, the stomach, and the early portion of the intestine. The two most common procedures that we undertake currently are the sleeve gastrectomy or gastric sleeve in the gastric bypass. With the gastric sleeve, we actually partition the stomach. We divide the stomach into two portions, one smaller portion that remains inside, and a larger portion that we actually take out. So that at the end of the procedure, the stomach, which used to look like a watermelon, would look like a banana. That is essentially what the sleeve gastrectomy is. So the procedure is really centered on making the stomach smaller. With gastric bypass, there is also partition of the stomach, but instead of just dividing the stomach, we actually rearrange and reroute the small intestine as well. So a little bit more involved procedure. Regardless, with both procedures, we are intervening on this upper portion of the digestive tract. Currently, bariatric surgery has achieved a safety profile which is really unprecedented in its history. In fact, we consider procedures like the gastric sleeve equivalent in their safety profile to things like gallbladder surgery or hysterectomy, which is amazing, of course. One of the major developments has been the fact that now we are able to do bariatric surgery through small incisions, inserting slender instruments to undertake the whole procedure. And that has really changed completely the way patients recover after bariatric surgery, but also the potential for risks and complications with bariatric surgery. It is very important, Kamal, for us to talk about risks and complications of the procedure. And this is important for two reasons. One, it is very important for patients to understand the risks involved in a treatment that we are proposing they undertake. In fact, their decision on whether to go ahead with the surgery, their decision-making process has to be really tempered by their knowledge of the risks and complications. And of course, like any treatment, we have to be able to provide the balance of risks and complications of the treatment versus not having the treatment. And that's really important in any discussion about any type of treatment. So patients understanding the risks and complications is a very important component of the process of preparing them for bariatric surgery. But the other reason why it is important for them to understand Kamal is because we want them to be knowledgeable enough for them to really ask for help if they were to have any symptoms of the risks and complications of the surgery. So because of this, we really spend a lot of time educating our patients about risks and complications. It is useful to look at risks and complications in terms of the short-term complications and long-term complications. And let's focus first on the short-term potential complications of bariatric surgery. We talk about three really major potential complications around all types of bariatric surgery. One is the potential for infection. The second one is the potential for formation of blood clots. And the third one is the potential for bleeding or internal bleeding as needed. Now, infections. Why can infections happen? Particularly the more serious type of infection can happen if the wounds that we create to divide the stomach do not heal very well, or to divide the intestine do not heal very well. This leads to something called leak, which means that substances that are supposed to stay inside the digestive tract leak out into the rest of the abdominal cavity, causing an infection. Right? So these are the so-called leaks. It is very important for people to understand that these are very rare. It's very important. But not only that, because obviously we're very focused on preventing them, we don't see them nowhere near as often as they used to in the past. Very, very rare, but it is nevertheless a potential complication.
Rare in a way that it's less than 1 in 500, 1 in 1,000.
Absolutely,
so it's
absolutely.
very rare.
Yeah,
So
very,
because
very
we
rare.
have-
Yeah.
How we know that is because we have to report our numbers to the national database, and that's why like we know that. But it's a risk that we still need to discuss. But it's very rare, as you said.
Absolutely, absolutely. So what do we do about this? The number one focus again is prevention. That's why this complication is so rare, because we focus on prevention and we've been really very successful in minimizing its occurrence. So as I say, leaks can occur if the wound on the stomach or on the intestine, for instance, don't heal very well after we divide them and reattach them. Well, what we do first of all is we use materials that buttress these wounds, that minimize the chance of leakage happening. Secondly, we look and examine that area very thoroughly at the end of the procedure to be absolutely certain that there is no potential for any leakage to happen. And then thirdly, and most importantly, is we educate our patients so that if they experience any type of discomfort that could be suggestive of this, for them to reach out to us so we can take care of this. So even if this were to happen, we can take care of it, we can fix it, we can rescue this patient from becoming potentially very sick. The other potential complication is formation of blood clots. These are clots that can happen in the legs typically, and that they can travel into the lungs, right? This obviously can happen with any type of surgery, but it can happen more frequently when the patient undergoing surgery is morbidly obese, just like our patients essentially. Again, this complication is seen very, very rarely because we focus on prevention. And the prevention that we utilize, Kamal, is first of all, we get our patients up and walking early after surgery. As you've seen in our surgery center, you see patients walking around within a couple of hours of surgery. And we encourage them to do that even after they go. Very important. The second point is, before patients go to the operating room, we give them actually a medication, a blood thinning medication, that will tip the balance of bleeding and clotting a little bit towards bleeding, making the blood a little bit thinner, so the chance of clotting will happen. And this was something that surgeons struggled with a lot in the past, particularly when they did open surgery, because they were worried about bleeding. But with laparoscopic surgery, the chance of bleeding is much less. So we're very comfortable giving patients blood thinning medication before the surgery has started, and that really decreases the risk greatly. And then the third important method for prevention that we use is we place special hoods around the legs of the patients, so that when patients are asleep under anesthesia and their legs are immobile, these special hoods will actually pump the blood by compressing their cuffs intermittently throughout the procedure. With these methods, we are actually able to reduce the risk of blood clots. And then the other third potentially serious complication is bleeding come out. And as I said, we use instruments that allow us really to seal blood vessels completely as we do surgery, that decrease the risk of bleeding considerably as well. So although these complications obviously can happen, we can never say that the complication rate goes down to zero. Nothing goes to that level. We can confidently say that we've reduced the risk of complications greatly, making these procedures very, very safe.
So the way that we build the program is clearly trying to getting the patient ready for the best experience, best outcome. When we talk about best outcome, because it's a weight loss surgery, as soon as I say outcome, most people are thinking about just the weight loss, but that's not it. So we want to make sure that we are getting there safely. So with the blood clot and other types of issues, the screening process, the blood work that we have, like we don't necessarily have hematology involved unless there is a problem with the hemoglobin level. So we don't have endocrinology involved unless there's an A1C uncontrolled. Usually it's over 8 and 9. And cardiologists, they take care of what they need to do on their side. Psych, this is as part of the, actually all the kind of complications, short-term and long-term, are kind of connected to our screening process and why we screen patients. But I think there's also part that patient needs to really understand and follow, especially after the surgery. So because I know our facilities are most sterile, clean places, but as soon as they go home, how do they actually follow through? And even before that, do they really understand exactly what they need to do? And then we do see in some cases where we give the great discharge instructions, but what we see is they go home and they're like, hey, we really forgot about this. So while written discharge instructions, that's why it's important. And especially for those who are helping these patients, the family members, friends, when they go home, they really need to help with the discharge instructions, understanding of it, and make sure that when there's a wound, there's the entire surgery itself. The hygiene is going to be important. Moving is going to be important. What you eat, how you eat, how much you eat, especially in the first couple of weeks, these are extremely important. So we'll be able to, reduce and prevent some of these risks. Dr. Can you talk about a little bit on the long-term risk and complications?
Absolutely, absolutely. So we've talked about the fact that bariatric surgery, particularly the most commonly done procedures, involve a change in the upper portion of the digestive tract. That invariably also will change how we process food, how we process nutrition, right? On the one hand, obviously, we change things so that the patient ultimately will be taking less food, right? That's the whole idea, is to decrease the amount of calorie that is consumed. But with that, obviously, there could be a danger of decreasing essential nutrients, the so-called micronutrients or vitamins, right? So part of the education process will involve really getting the patients to understand that once they've had bariatric procedures in the form of sleeve gastrectomy or the gastric bypass, very importantly, they will have to be on the vitamins for the rest of their life for them to stay healthy. So this is very important. So unless patients take those vitamins regularly and they follow up with us and they have blood tests on a regular basis, they could be at risk for malnutrition based on lack of vitamins. Right, and there are some very important vitamins. For instance, if they lack vitamin B12, that could put them at risk not only of problems with their blood count, but also with problems with their nerves. Nerve damage with B12 deficiency that goes on for a while actually could be irreversible. So these are serious problems. There could be problems with vitamin D and therefore bone health, right? So very, very important things. If they don't take adequate amounts of iron, particularly young women, they could have anemia, right, which means low blood count. So all these are very, very important points that are going to happen because of the surgery, because of the changes in the surgery, and unless these steps are taken, the complication is coming.
Absolutely. So now the Dumping syndrome is one of the common ones that we hear, and I don't know how often it happens, but it's kind of like when you search, it's one of those things. Can you explain that a little bit?
Absolutely. So Dumping syndrome, first of all, it's far more likely to occur with gastric bypass than with the gastric sleeve. With gastric bypass, specifically because of the change of the anatomy that occurs after gastric bypass, dumping syndrome is much more likely to happen after gastric bypass. And essentially, it happens when there is a rapid emptying of stomach contents into the intestine. As you remember, with the gastric bypass, what we've done is we've cut the stomach into two portions, and the top portion of the stomach is connected directly to the intestine through an opening that will allow the contents from the little stomach to enter the intestine rapidly. Right? Now, that rapid emptying of the food into the intestine can cause dumping syndrome, which is a set of symptoms that include things abdominal pain, cramping, diarrhea, maybe nausea, maybe vomiting, or even passing out. Right? This happens more if the patient has consumed refined sugars, so desserts, ice creams, cakes, cookies. All those things can actually cause dumping syndrome in a patient who has had a gastric bypass. So much so that, and the symptoms are quite really upsetting. And if patients have experienced that once, they may never touch anything sweet afterwards because they can be very severe. And of course, you can say that could be a good thing, because obviously, if patients are discouraged from having sweets, then obviously will increase their success rate.
The things that you just mentioned are the things that we need to stay away from.
Absolutely.
We shouldn't be having. I know sometimes my friends who are watching this, they tease me by sending messages during the session saying that, hey, I'm having this, I'm having that. Yes, that's fine, but if you have the surgery, the consequences is not going to be pleasant.
Absolutely.
So it's not like a disorder in any way. It's just like how your body is going to react to those. But then the whole point of getting the surgery wasn't just having this tool in place, but also making changes in our lifestyle and understanding what got us there, and making those adoptions so that we don't go back to the same place, right? So,
So dumping syndrome would be one, for instance, that you see mainly with gastric bypass, but also with gastric bypass, you can see something like ulcer formation, where the connection between the little stomach and the intestine can develop a wound that we call an ulcer. Right. And that could be very, very painful, and that by itself can lead to other complications like bleeding or perforation even. Now, that complication is much more likely to happen if the person is a smoker. That's why smoking is a big no-no after bariatric surgery. But with patients who have gastric bypass, that complication can also happen if they take a class of medications known as NSAIDs, non-steroidal anti-inflammatory drugs, which essentially are medications like aspirin, Motrin, ibuprofen, Aleve, right? So those medications are actually a no-no for patients who have had gastric bypass. Alternatively, if you look at patients who've had the gastric sleeve, one potentially long-term complication would be the development of acid reflux or heartburn, right? And some of our patients may have to take anti-acid medications because they develop heartburn.
Now, the next is there are some psychological impact of the surgery. Now, this is a life-changing event, and prior to the surgery, we do ask our patients to get psych clearance. And after surgery, yesterday, or it was this morning, I was, could be yesterday, it doesn't matter, but I was just telling Sean in the case conference, a patient lost 90 pounds, or it was out by the patient lost 90 pounds in 6-7 months. That's 1/3 of their total weight. So that's a big change.
Yes.
Now, how we are going to react to that, like what people are saying, what you are saying to yourself, that's one part, which actually kind of like, if you really have a good weight loss, and then if you are still dealing with those, that's fine. But if you don't get the weight loss because of certain issues that you have, and dealing with that is maybe more important, and then this is where the side problems are more problematic. And then the what I tell our patients is, look, we have resources available. We have 2 social workers in our program. We have 5 nutritionists, and I know nutrition is not side, but if you are actually having those nutrition sessions, then chances are they will pick up certain things that you are, even if you are not telling them, they will pick up certain things and they communicate with us. So we will be able to get in right people in place, right resources in place to help the patients. So every complication, what it comes down to is like, hey, are we communicating in a timely manner? And do we really understand what we are going through? So if you keep in touch with the program, then also all these videos that we have, this is the same topic we probably covered at least 7 times.
Absolutely.
It has its own playlist. So you see how we age from 2021 to 2024. So
We're staying young.
we're staying young, of course. So this is how we actually go through this. So that's what I would tell our patients to really understand how simple actually is to prevent these issues from the get-go. Now, success stories, challenges for patients to discuss these in kind of setting like our bariatric support groups. How important those things are for our patients for the long term?
Very important, very important. So these are settings where patients could really find solutions for challenges that they go through, right? When you have almost like a group of people who have gone through what you are going or are going through the same process themselves, that creates a sense of camaraderie that really gives you support, as the word says. It really supports you. So it tells you that you are not alone and you don't have to fight that battle alone. Right. So from giving you moral support, it's really very important. But there is a practical side to that as well, right? Patients could be talking about, for instance, what ingredients to use to create a certain recipe, for instance, that would be healthy for them, right? An idea from somebody in their group. They could be talking about multivitamins that are better tolerated than others because of their flavor or constitution. They could be talking about help, for instance, if they have excess skin and they're looking for removal of that excess skin of plastic surgeons that may be in the area, or when to think about getting plastic surgery. Or it could be really things related to relationship problems that could arise because of the drastic changes that have occurred physically and mentally in a person who's had bariatric surgery. So these support groups are very, very important, and they are ongoing, right? Because challenges could be ongoing as well, right? Problems and challenges that were not present this month or this year could be present next month or next year. And if there are people who have gone through that and they have worked out ways to really get through these challenges safely, then for them to share those are very important. But another way to understand the importance of support group, or also to get almost like a sounding board, right? But audience that is going to listen in a sympathetic fashion, the problems that you're going through, because bariatric surgery is a unique experience. It's not something that everybody experiences, because not everybody undergoes bariatric surgery. And to add to that, because there is this huge stigma associated with obesity and the supposed treatment of obesity, you may not find much support and sympathy outside that circle of people who had bariatric surgery. So having that group of people to whom you can reach and really in a judgment-free way, getting all those things discussed actually will be very, very helpful for the long-term success of patients.
So just so that wrapping this up, this program is one of the most successful bariatric program in the United States, with our surgical expertise and program expertise, because we have done this in a couple other programs with the other hospital systems. So when we look at what we have, the comprehensive approach to the issue and trying to mitigate the risk early on and understand how we prepare our patients, how we actually getting them ready, and how we follow up with them, what screenings that we have to go through, what clearances that we have to go through. All these things is to make these risks and complications. It's all about minimizing those. And so far we have that. The only reason we are sharing and having a session is, other than the education, is just because people should know, but not because we have these problems on a daily basis. We don't. But still, we need to make sure that patients are well educated and understanding what they are going through. And understanding is going to make a big difference. And follow-up is going to make a big difference. So with the pre-surgical steps, we won't let them to go through the surgery unless we have all our checkpoints. But after surgery, post-surgery, so patients are on their own. If they don't communicate with us, there is not much we can do, but we are still trying to reach out to them. But making this the best part of getting the weight loss after the surgery and seeing the result is, can we actually have the longevity of this weight loss? Can we maintain it? And that becomes a new norm for our body. So that's why we are here. And hopefully those who are watching are benefiting from this. Dr. Rida, thank you for so much joining us.
Thank you.
And then we'll be back just with our third session today. So it's a great day for all of us. And we will be back next week with another topic. Thanks again.
Bye.